Hello, I'm Dr. Yatros from Dental Sleep Solutions, and I'm here to talk about 5 of my favorite dental devices in 5 minutes. They say I talk fast, so we're going to see if I can do it. I'm going to put my watch right there and we're going to get on it. We're going to talk about these 5 appliances. These are the ones I do the most. We're going to start with the Medicare devices. Of the Medicare devices, you have your choice between a Herbst and a tap, are the 2 that I do. A Herbst is the one I probably do more than others. I like it very much because it allows opening. The patients can move their jaw side to side, and it has very fine increments of adjustability. We can turn the screw and it can go anywhere from 1/8 of a millimeter, depending on which design we have, to 1/10 of a millimeter. We have a range of motion between 7 and 8 millimeters, depending on which design we have. Various labs will make different devices. It comes in a material that's flex material on the inside, or you can get it with hard acrylic and hooks at some labs. Even some labs make it in the thermoplastic acrylic that we use in other devices. There's also a different attachment called the Advance that one of the labs makes that allows for a little bit more advancement. Great device, works well. You may want to look at the pros and cons. The pro is that it's more comfortable. The patients can open their mouths with it in place. Swallowing's better. That's also a con because the jaw may open, and so we may have to add elastics to make this work better. It's durable, works well, a very good device we use all the time at Dental Sleep Solutions. The other Medicare device that we will use is the Tap 3 Elite with the double bar. The Tap 3 Elite, not to be confused with the Tap 3 that does not have the double bar. This device has been around as long as any. Lots and lots of research have been done on the Tap device, and it's one we utilize quite often, especially for our bruxers, for our patients who have advanced OSA. It's just a great device. So it has different hooks that we can use here. The hook, I don't know if you can see that with the video, but the Tap 3 Elite has a longer and a shorter hook. We can turn the Allen wrench that we use to adjust this, and it goes in 1/4 increments. Each 180-degree turn is 1/4 of a millimeter in increment, and by utilizing the different hooks, we have as much as near 12 millimeters of adjustability with this device. Great device if you don't want the back teeth to hit, because it can deprogram, much like an NTI type anterior deprogrammer. The materials that it typically comes in is a flex material, which is the soft material on the inside, or the thermocryl, which is the heat sensitive thermoplastic acrylic that I often prefer, that we can make it fit tighter and looser depending on the situations. The pros of this device, been around a long time, researched one of the most. We utilize it oftentimes for people that have more severe OSA. It is a tried and tested device. Cons, it may take up a little tongue space. It can be less comfortable in some situations because of the tongue space that it takes up. All right, we'll move on to our non-Medicare device. We have an EMA. An EMA is oftentimes an underutilized device. It essentially is very similar to 2 of the upper and lower Invisalign suck down type trays that we do Invisalign. It comes with 4 different rigidities of bands and 9 different lengths for adjustability. Very small device, very neat, and the pros and the cons of this is it's very good for aesthetic patients. There's not much there. We move the jaw forward and we take up very, very little tongue space, which is something that is really desired. It works quite well, and the patients we use it on are the people who are aesthetically oriented. A lot of times dating people who maybe are conscientious about the way some of these other devices may look or may not look, and it works quite well. People who have mildline teeth, maybe not as good as the people who have really straight teeth, we prefer it for, and the durability is not quite as good as some of the other ones, but it is one of the least expensive ones out there. One of my favorite devices overall is the Dorsal design. We use this one quite often. Named Dorsal design because of the wings that it look like a dorsal fin. Various labs make different iterations of this particular device. Great adjustability, 1/10 of a millimeter adjustable as we move this device that's mounted on the upper with our key, and we can move it in the neighborhood of 5 to 6 millimeters of advancement. It comes with different labs make it differently. Hard acrylic in some with flex material. Some you can even get the thermal plastic acrylic that we can adjust. You'll always want to get the rubber band hooks for these or slots so that you can allow the patient to not open. Lastly, we're going to be close. I don't know. We'll see. Is the Narval device. The Narval device is one of the newest devices. Very comfortable, very light, takes up very little tongue room for the patient. It has essentially about 32 adjustments now with the half increments. We have 1 millimeter and half millimeter adjustments, and it's a very adjustable device. It's the only, to my knowledge, 3D printed polymer device, so it works great as far as always fitting. The pros to it, it's comfortable, works great, very little tongue room taken up, had very great results with this. The negative is it is a polymer and you can't adjust it very rapidly. You can't add acrylic to it, so the teeth have to be in pretty good shape, or you don't want to use this device because you can't add to it in the future, and it is one of the most costly devices. Well, I don't know how we did, but that's me, Dr. Guy Yatros from Dental Sleep Solutions and Dental Sleep Medicine Insider magazine, and there's your 5 devices in approximately 5 minutes. Thank you.